My name is Aleena Gigi. I'm Assistant Professor in the Department of Anaesthesia and Operation Theatre Technology, Yenepoya School of Allied Health Sciences. Today we'll be discussing on anesthetic face masks. Specific learning objective. At the end of the session, students will be able to list and describe the key parts of face mask and its purpose, enumerate the different types of anesthetic face mask and its features, explain the technique of using a face mask, and to list the advantages, disadvantages and complications. Anesthetic face masks are devices used to deliver anesthetic gases to patients during spontaneous or manual ventilation. They act as an interface between the patient's upper airway and the breathing system. Anesthetic face masks help avoid invasive procedures as they don't require any apparatus inside the patient's mouth. Many masks are made of antistatic rubber to prevent the ignition of the anesthetic gases. The face mask should fit snugly on the face without a leak and must be comfortable for the patient without any undue pressure. The purpose of anesthetic face mask: to administer anesthetic gases to the patient during surgeries either by spontaneous breathing or manual ventilation. Masks are used to oxygenate the patient pre-operatively or to administer general anesthesia. The mask creates an airtight seal the mouth and nose, ensuring proper delivery of the gases. Parts of anesthetic face mask. It consists of mount, body and seal, and sometimes a harness hook to attach the strap. First, the body. It is also called as the shell or dome. It constitutes the main part of the mask. A transparent face mask allows observation for any vomit, secretions, blood, lip color and exhaled moisture and is better accepted by a conscious patient. The seal. It is also called as a rim, flap or edge. It comes in contact with the face. It consists of two types of seal, a pad type seal and a flap type seal. So, a pad type seal is inflated with air or is filled with a material that will conform to the face when the pressure is applied. And a flap type seal, it is a flexible extension of the body that conforms to the contour of the face. It is pressed to the face to create a seal. Now the connector. It is also called as a orifice, collar or mount. It is present at the opposite side from the seal and it has a thickened fitting with a 22 mm internal diameter and a ring with hooks also may be present. It allows to connect a mask to the strap that is attached. Types of anesthetic face mask. First one is open face mask. So, the open type such as an Hudson mask which is commonly used for delivering supplemental oxygen. It does not provide a tight seal against the patient's face and there are often additional holes in the mask to allow the expired gases to escape. Hence, this mask is not used for ventilation purposes. This is an Hudson's face mask. Second one is closed face mask. So, these are designed to provide a complete seal around the patient's mouth and nose. This feature allows safe delivery of the volatile agents and if required for the patient to be ventilated with a positive pressure. This type of mask is commonly used during resuscitation and during general anesthesia. So, closed masks are of different types and first one is anatomical mask which is of black rubber and silicone material. Then we have echo mask, ambu transparent mask. In pediatric face mask, we have Rendell-Baker-Sosik mask, lateral pediatric face mask and endoscopic mask and the last one is Hudson mask. First one, anatomical black rubber face mask. So, this is also called as a Cornell mask. Its body is made of rubber that can be widened or narrowed to fit to the face. It is available in sizes of 0, 1, 2, 3 and 4. Next one is trimer mask. It is similar to Cornell mask and it has a shallower body and a less dead space. Then Snuggie silicone and black rubber face mask. It is an autoclavable, soft, contoured, cuff snug face mask. It provides patients comfort as well as makes for easy cleaning. The one-piece construction and silicone rubber also allows for a clearer view of the presence of any vomit, the patient's lip color as well as any other oral secretions. The sizes that are used are 0 for infant, 1 for small child, 2 for child, 3 for small adult, 4 size for adult and 5 for large adult. Second one is Eco Mask. It is a non-PVC single-use anatomical face mask. It has a clearer vision of the traditional reusable rubber face mask. It has non-slip rings for a better grip and a tight seal. Its anatomical shape, soft seal for a comfortable fit, transparent shell for excellent visibility and available in range of several sizes with distinct color coding for easy selection. This is Eco Mask. Next one is Ambu Transparent Mask. The Ambu Transparent plastic with inflatable cuff for a seal and it has a thumb rest built into the body. Next one, Rendell-Baker Sosic Mask. It is designed for pediatric patients. It has a triangular body and it is usually available in sizes 0, 0, 1 and 2. It has a low dead space, that is 4 ml in the size 1 and 8 ml in size 2. It adequately fits the child's face and no other special seal is needed. Some of these masks are scented and may have a pacifier. So, this is the image of Rendell-Baker Sosic mask. Next one is Ladle Pediatric Mask. It is made of silicone rubber. It has an inward curving circular face seal. It can be boiled or autoclaved. It has been found to be better for ventilation of newborn and for pediatric patients. This is the Ladle Pediatric Mask. Next one is endoscopic mask. So, an endoscopic mask is designed to allow mask ventilation while an endoscope is being used. The port or diaphragm in the mask body allows a fibroscope to be inserted into the nose or the mouth. A tracheal tube previously loaded over the fibroscope can then be advanced if it is desired. This is an endoscopic mask and this is how an endoscopic mask will be used. Hudson's face mask. It is made of clear plastic and it is transparent. On sides there are air entrainment holes. It is variable performance mask, that is the fractional inspiration of oxygen delivered is the oxygen flow dependent. This is an Hudson's face mask. Now, the technique of using anesthetic face mask. This can be achieved either by a one-hand or two-hand technique. Place the correct size mask over the patient's nose and mouth. The main benefit of using one-hand technique method is that it enables one person to create an airtight seal with the face mask and using the other hand to freely ventilate the patient. The aim of using an anesthetic face mask is to ensure a complete seal between the mask and the patient's face while exerting the minimum of pressure that may cause soft tissue damage. First, it is important to choose the correct size for the patient. It should sit over the bridge of the patient's nose with the upper border aligned with the pupils. The sides should be sealed lateral to the nasolabial folds with the bottom of the face mask sitting between the lower lip and the chin. When the patient is unconscious, the airway must be held open while maintaining this seal. It is crucial to ensure the airway is patent since gases given under positive pressure may otherwise insufflate the stomach and increase the risk of aspiration. The most effective method of opening the airway in this setting is to employ a jaw thrust technique. This can be achieved by using either one-handed or two-handed technique. So, this is the one-handed technique and the two-handed technique. Jaw thrust one-handed technique. The mask should be placed correctly over the nose and the mouth, and use your non-dominant hand to position the face mask, holding the body of the mask between the thumb and the index finger. Use the remaining 3 fingers to support the jaw with your little finger hooked behind the angle of the mandible. Avoid pressing the soft tissue under the jaw, as this can block the airway, especially in children. Lift the jaw up towards the mask to create a tight seal. Slightly tilting the head back, this can help the airway to be open. Ventilate the patient with your dominant hand by squeezing the bag or by using bellows. Continuously assess the adequacy of the technique by observing bilateral chest movements, listening for air leaks, and assessing for signs of inadequate face mask ventilation. In this video, it will be demonstrated how to do a jaw thrust maneuver. Before handling the patient, appropriate PPE should be worn. Identify the angle of the mandible. Place the fingers behind the mandible. Lift in an upwards and forward direction. Use your thumbs to open the patient's mouth. So this is how a jaw thrust maneuver is being performed. This is how we can ventilate the patient using the jaw thrust maneuver with one hand technique. Signs of inadequate face mask ventilation. First one is poor chest expansion, absent or quiet breath sounds, audible gas leak or unavailability to generate positive pressure with the bag, visible gastric insufflation or audible insufflation with stethoscope. Absent or poor end-tidal carbon dioxide trace if it is being used. Patient shows signs of cyanosis or, if available, low oxygen saturation, that is less than 92%. Hemodynamic consequences of hypoxemia or hypercarbia, tachycardia or abnormal blood pressure can be hypertension or hypertension. Advantages of anesthetic face mask. So, the anesthetic face masks are designed to administer anesthetic gases to the patient during spontaneous or manual ventilation. An anesthetic mask fits over the mouth and the nose to create an airtight seal and are used to oxygenate the patients pre-operatively or to administer general anesthetics. These face masks have a cuff that allows for complete seal to be achieved between the mask and the patient's face. Anesthetic face mask can therefore be used to deliver non-invasive ventilation. Disadvantages and complications of anesthetic face mask. Poor mask fit or seal can cause gas leaks, preventing proper airway pressure and contaminating the operating room with the anesthetic gas. Decreased lung compliance due to bronchospasm, edema or pulmonary fibrosis can make the ventilation harder. Higher airway pressures may be needed, which can cause leaks around the mask, lead to air entering the stomach, that is gastric insufflation, reduced effective air delivery to the lungs, that is alveolar ventilation. So, to summarize, anesthetic face mask can administer gases during ventilation, creating an airtight seal over the nose and mouth for oxygenation and for anesthesia delivery. Anesthetic face masks include open, closed, anatomical, ambu and pediatric specific masks, each tailored to different patient needs. Parts of the mask include body, which is a transparent dome for observation, a seal, a rim or flap that creates an airtight connection, and a connector, a 22 mm orifice collar mount for breathing systems. One-handed or two-handed techniques ensure proper face mask application. Poor fit can cause gas leaks, gastric insufflation or ventilation issues. These are my references. Thank you.